If I could reimagine the world,
it would be one where everybody had enough food, enough shelter, and was provided with adequate health care. It's not real complicated.
It would be taking down the barriers imposed by poverty. It just seems like a crime against humanity that we have all this technology and all these resources, yet we can't help our fellow man out.
In my reimagined world, everyone will act on their beliefs. And if we act on our beliefs, there shall be no hunger, poverty, disease that cannot be treated. The Wyss Diagnostics Accelerator, or the Wyss DXA, has 3 specific programs. The first one, Brigham Wyss Diagnostics Accelerator, it's a collaboration between Brigham and Women's Clinicians and Wyss Institute. The second program is the Industrial Participant Program, or IPP, where industrial participants, primarily diagnostic companies, join this program. And the third program is BEADLE, Biomarker Discovery Laboratory, or BDL. We knew that we had to get into biomarker discovery, and we were able to hire a world-class proteomics expert, and our first mass spec, which we got some months ago, has been named Lennon after John Lennon.
The motivating factor for establishing the Diagnostics Accelerator at the Wyss and the collaboration with the Brigham is engage with clinicians with unmet clinical needs who then create a problem pull for a technology as opposed to taking a technology and then trying to figure out what it's good for. The Wyss Institute is embedded in this incredibly rich environment, and we really should use that as a way to find interesting problems.
Diagnostics is usually the gateway to healthcare. You know, you come in with a sore throat, you don't know if it's strep throat, you don't know if it's something else, COVID maybe, you know. Therapy is like the golden child and everyone thinks about that, but the only way you get to the therapy is with the right diagnosis.
When I travel and see all those needs that can be solved with existing technology, it could be as simple as providing clean water. Vaccines that already exist. It makes me sad, then it makes me angry, right? And also makes me feel guilty. And I use that all in a positive way to propel me towards that world that I'm imagining, where all types of suffering, especially from diseases that have solutions, will not exist.
We see the IPP as a platform for IPP members to dock into the Harvard ecosystem, and then also have companies have a way to partner with each other.
We're trying to develop point-of-care tests for neglected and emerging infectious diseases. The idea that if you diagnose people up front, you can improve the odds of successful treatment, which is often underappreciated. People used to say an ounce of prevention is worth a pound of cure. Maybe it's a pound of prevention should be worth an ounce of cure. IPP is a group of incredibly talented, smart people. I think there are very few organizations devoted to diagnostics in the academic medical world. Who wouldn't want to work with the Wyss Institute?
Our team at Folia is focused on learning more about how the diagnostic discovery process is done right now, and how phenotypic data that's deep and rich on the individual level can be fed into that process to make it more precise. And that's why we're so excited about working with the IPP. What goes wrong even in therapeutic development, there are many people who talk about the fact that when we are not precise enough in diagnostics, it can have a huge impact on even understanding which therapies work because you may not have the right people in the study to begin with. So diagnostics is definitely key.
COPD stands for chronic obstructive pulmonary disease, and we don't have a good way of distinguishing it from other conditions, heart failure, pneumonia, or even a simple cold. I think it would be a real benefit to COPD patients to have an early warning system, something they can track at home so they don't have to go to the hospital. Science in general has always been very siloed, and it really takes these organized efforts to break down silos to get different people to talk and start to identify solutions.
It's kind of an exciting opportunity to just think like, oh, can something that feels impossible actually be possible? Moving technology out of the way in terms of non-invasive monitoring for little babies so that they can spend more of their times in the arms of their parents without sacrificing our need to be able to monitor their vital signs closely. When your child is sick, you're sick. You don't want to see your child in pain. You don't want to see your child suffering. When nobody knows exactly what's wrong, that's the worst feeling in the world.
I would love to be able to say that this model enabled a technology to get into clinical care and changed patients' outcomes for the better. I think that's a win.
I think the call to action would be get involved. So if you're a clinician, submit your needs. If you're a Wyss researcher, come talk to us about all the needs that we have. So if there's really cool solutions that are waiting, maybe we can fast track those needs and make sure that they get into the pipelines. And companies that are out there that want to plug into the IPP, let us know.
The vision that we have, the passion that we have, the mission that we're on is to bring cost-effective diagnostics quickly to wherever, whenever needed. So if you believe in that, then come talk to us.